In late February, Chinese medical professor Liu Jianlun crosses the border from Guangdong into Hong Kong and checks into the Metropole Hotel in a densely populated Kowloon neighborhood. Soon after, the 64-year-old comes down with fever and is admitted to hospital. By the time he succumbs to what's described as atypical pneumonia, Dr. Liu had infected 7 other hotel guests. These visitors go on to spread the virus to other parts of the city and abroad to Singapore, Vietnam, and Canada. Ward 8A of the Prince of Wales Hospital in Sha Tin admits a patient who had visited the Metropole Hotel on February 24, moving the epicenter of Hong Kong's outbreak to its hospitals. Less than a week later, 7 doctors and 4 nurses from the ward call in sick. The disease eventually infects over 100 medical and nursing staff in the hospital. A kidney patient who had been treated in Ward 8A of the Prince of Wales Hospital visits his brother in a Kowloon Bay housing complex. This visit would trigger the city's first community outbreak. The virus spreads rapidly through Block E of Amoy Gardens, infecting over 300 residents. 42 people eventually die from the illness. The disease is named Severe Acute Respiratory Syndrome, or Sars, after the World Health Organization issued a global health alert a few days earlier. SARS would eventually spread to 29 countries and regions on 5 continents. Then, experts from the University of Hong Kong announce a breakthrough, identifying a coronavirus linked to SARS and evidence it originated from an animal virus.
It appears to us that the coronavirus is the primary cause of this disease, SARS, what we now call coronavirus pneumonia. More important is that these findings have been now confirmed independently by our own Department of Health and also internationally by the Centers of Disease Control in the United States.
As the WHO team joins local health experts in the hunt for how the virus spread in Amoy Gardens, for the first time ever, Hong Kong issues a public health isolation order requiring 115 households in Block E of Amoy Gardens to quarantine at home. Amid a worsening outbreak, they were then evacuated to government-run holiday camp facilities to complete their 10-day quarantine. Rumors of a citywide lockdown begin circulating in the community, forcing the government to refute them. The outbreak in Amoy Gardens is blamed on environmental transmission, spread rapidly through defective drain pipes in bathrooms. As the virus sparks a 7-week-long school shutdown, SARS also devastates Hong Kong's economy. The WHO advises against all but essential travel to Hong Kong, and without tourists, retail operations take a beating, turning the city into a ghost town. Other economic sectors like the property market, which has already been battered by the Asian financial crisis, plummet further. 17 weeks since patient 0 entered the city, the WHO declares Hong Kong free of SARS, but not before killing 299 people, including 8 medical workers, and infecting 1,755 others. In the aftermath, the government sets up a task force to revitalize the economy, as well as another to improve the city's environmental hygiene in hopes of averting another public health crisis. A report by a SARS expert committee looking into the government's handling of the outbreak issued a series of recommendations, saying the most important lesson from the SARS experience is that we must be prepared for new and emerging infectious diseases. Years later, experts on the front line of the SARS fight warn that the city must not forget the painful lessons learned.
I mean, an infection at one place can easily spread to the other within 24 hours. So I'm sure that all these emerging infections will come again. The magnitude is difficult to predict, but it can be very fatal, it can be very widespread. We must prepare. If we don't prepare when the disaster comes, it's a replay of Hong Kong in 2003.
Several years later, Professor Yun's warning comes true, this time in the form of a coronavirus that spreads across the world, causing illness and death on a scale not seen before. Hong Kong, while more familiar with regular sanitation and face mask wearing from its experience with Sars, is nonetheless pushed to the brink over a 3-year period as millions of people become infected with what becomes known as COVID-19. The new pandemic raises questions about what Hong Kong has learned from its public health crises and whether it will be better equipped to face the next one.